Helping yourself recover when you've got chronic pain is very difficult. Following your injury as you recover, it's not usually a smooth path. There'll be times when you might have more pain and you might be worried about that. During treatment, your physiotherapist will often provide you with strategies to use when your pain might be higher, and you might use those. They might be things like stretches. If you're very worried and you have a new pain or a different pain, it is worthwhile seeing your doctor or your physiotherapist earlier possibly than your next appointment. But mostly there are variations in pain as you're gradually improving, and you might just reduce your activity levels a little bit. You might use some ice or heat, depending on your advice, to help settle that period of pain down. What we advise first off is not to panic. It's quite hard to do further damage. And most likely the increased pain you're experiencing is to do with your nervous system being more sensitised. So often the strategies you're being taught with your physiotherapist or a psychologist, they're going to work to help reduce that pain. So calming, pacing, you might find light stretching works. For some people, it's more of more using distraction. You might pat the cat or water the garden. Do some light activity or talk to a friend. In chronic pain, these periods of sensitisation are often 1 to 2 hours long, and if you wait them out, the pain will start to settle back down again after a short period. Research tells us that some people seem to be more vulnerable to developing chronic pain than others. There is an element of genetics, but also environmental factors that change whether you're likely to develop pain after an injury. We know around 10 to 20% of people will develop pain after an injury and after surgery. In low back pain, the factors have been shown to include a previous history of injury, a job where there's a lot of lifting, pushing, pulling and vibrating, psychological distress and dissatisfaction with work. Lack of exercise and smoking are also risk factors for developing more distressing and disabling low back pain. We know that disabling low back pain is more common with increasing age. It's more common in women. And certain premorbid factors such as high levels of psychological distress, poor self-rated health and smoking are associated with more disabling pain. Good outcomes are associated with low levels of psychological distress, higher than average levels of physical activity, being employed and satisfied with your work status, and also having a short duration between the onset of pain and seeking help. So when you feel pain coming in, it's easy to panic, but it's common for pain to be worse at times and not as bad at other times. Often people worry that there's more damage or they've done something they shouldn't, but that's really unusual. Mostly if you wait a couple of hours, your pain will have settled back down again. This is particularly relevant in terms of not taking pain medication too quickly, particularly when you have long-term pain. We know that medications such as opiates, such as endone and OxyContin, they take at least an hour to work, and they don't work well for pain that you've had for longer than 3 months. But it's distressing when you have pain, and we encourage you to be aware that pain will naturally come back down again. Try some calming, try some light activity, try some light exercises, and see if the pain starts to settle after that period, which it often does. A big part of pain physiotherapy and pain psychology is managing these periods where pain is increased. It's normal to feel distressed, and helping you manage that distress is an important part of learning to manage pain. Often we feel like we want to lie down when we have increased pain, and short periods of lying can be quite useful, but try and restrict that to 20 minutes or less, because we see that people who rest for long periods then tend to have trouble getting moving again, and less than 20 minutes is often a nice balance between a little bit of rest but not too long, and it keeps our body moving, which is important. When you have pain, the most helpful person is someone who walks alongside you, who pays attention to you but does not try to take over. It is important to remember that for each person with pain, it is a unique experience. It's not possible to experience the same pain as another person, and we should take care not to judge how a person is managing their pain and feel like if that was us, we could do better. When you have a family member who is in pain, it helps not to talk too much about pain. When a person talks about their pain all the time, it usually makes their pain worse. And most people with pain get sick of being asked how are they, whether their pain has gone away. Usually the answer to that is that their pain is still there, and if they're having a problem or an issue, they will talk to you about that. If you are living with somebody who has pain, there can be a lot of changes that happen in your life, with a person maybe doing a lot less of the roles that they would normally have, and possibly there are changes in when people are at home and not at home. We advise family members to remember that for each person in pain, it's a unique experience. Encourage you to avoid judgment about whether your family member has pain or should be doing more or less, and try to avoid blaming them for their situation. It is helpful for you to encourage activity, but using pacing, and also to talk less about pain. My top tips for getting the most out of physiotherapy are to remember that most pain settles down. Remember to stay active. Your physio can guide you with this, and make sure you understand what is happening in your body.